This is a presentation about asthma, a disease that I have lived with all my life. The purpose for this video is to help explain asthma so we can better understand its causes, effects, symptoms, and to learn different ways to help control it. As CNAs in training, it is important to realize that this respiratory disorder can affect infants, children, young adults, and even the elderly. Breathing is automatic. The average person takes between 12 and 20 breaths per minute, typically without giving the action a second thought. But when you have asthma, this all changes. Breathing can become difficult and even painful. For a person with asthma, the breathing that most of us take for granted isn't always so easy. This is because asthmatics have chronic inflammation of their airways, which causes the flow of air to become restricted. When an asthma attack occurs, the muscles surrounding the airways become tight and the lining of the air passages swell. As a response to irritation and inflammation, the mucous membrane produces thick mucus, which then further inhibits respiration. As a result, air is trapped in the lungs, causing labored and painful breathing. Asthma attacks can last minutes to days and can become very dangerous if the airflow becomes severely restricted. Some symptoms of an asthma attack may include wheezing, coughing, tightness in the chest, sweating, and fatigue. In sensitive individuals, including infants and the elderly, asthma symptoms can be triggered by allergy-causing substances including pet hair or dander, dust, pollen, mold, chemicals in the air or in the food, exercise, stress, respiratory infections such as the common cold, weather change, and tobacco smoke. While there are ways to help prevent the onset of an asthma attack, such as using medications like quick relief rescue inhalers or nebulizer machines, asthma can still cause severe complications, including a bluish color to the lips and face, permanent changes in lung function, a persistent cough and severe chest pain, decreased alertness, drowsiness, or confusion, rapid pulse, severe anxiety due to shortness of breath, and even death. People with mild asthma may use quick relief medication as needed. Those with persistent asthma should take control medications on a regular basis to prevent symptoms. A severe asthma attack requires a checkup by a doctor and possibly a hospital stay, where oxygen, breathing treatments, and medications through an IV will be needed. Asthma is a very serious respiratory disease, and it is very frightening for the asthmatic. And it is also very important to know our role as a CNA when caring for a patient or a resident with this disorder. Although we won't diagnose or give medications, our job is just as important as any other skilled medical professional. We will help with many aspects of caring for the patient or resident, including adjusting their bed to an upright position and use pillows to assist in easier breathing. Assist and encourage breathing exercises such as pursed lip breathing to help control breaths as ordered. Record vitals and use good health measures such as proper hand washing and disposing of tissues. Offer plenty of fluids to keep hydrated and small frequent meals when it's difficult to breathe. Provide rest as needed and encourage patients or residents to save their energy for important tasks and also to rest between the tasks. Also make sure they are not exposed to cigarette smoke or polluted air. While asthma is a serious respiratory disease, it is important to encourage as much independence with ADLs as possible. Make sure to be calm, reassuring, and supportive, as being unable to breathe or fearing suffocation is very frightening.
There is no cure for asthma. Although symptoms sometimes improve over time, and with proper self-management and medical treatment, most people with asthma can lead happy, normal lives.
Ready?
There is no cure for asthma. Okay.
Go.
Although symptoms...